Hello, everyone. Welcome back to this week's edition of our newsletter for our topic of elbow overuse injuries. My name is Dr. Mike. I'm here at our Carmel Mountain location. Last week, we had talked about some common causes for elbow injury, as well as some populations that are susceptible to those injuries. Today, we're going to talk a little bit about soft tissue work for it. Now, most overuse injuries involve muscle, ligament, tendon, and with that, contractile tissue, muscle, can get tight, it can get irritated with repetitive movement, repetitive motion. So what we work on with those kind of cases and injuries is a little bit of soft tissue release. If the muscle is constantly being used and overworked, it can remain tight. It wants to stay in a contracted position. It doesn't want to move. Applying a little bit of precise, uniform pressure can help release those muscles. I'm a fan of using lacrosse balls because they are only a couple dollars each. They're easy to use and they're great for all parts of the body. Now, with the lacrosse ball, place it on the table here. We're going to be working a little bit on the musculature of the forearm. We're working on some of the muscles that start at the inside of our elbow and run to our wrist. This area, when it does get inflamed and irritated, frequently referred to as golfer's elbow, these muscles are in charge of this motion here, bending the wrist and bringing it a little bit in line. So we're just going to go palm down, apply a little bit of overpressure with my left hand here. And we're just going to work the length of the muscle going up and down, starting just at the end of the elbow. If you feel onto either side of your forearm here, we have a couple bony prominences. We're starting just past that. And we're going to work our way going down the forearm, working our way back up towards that position. We're going to work the length of the muscle for about 30 to 60 seconds, running up and down, as well as working side-to-side movement. You can also incorporate some circles and some rotation with it. Nice thing about the lacrosse ball is that you can put as much pressure as you need into the elbow, so you can start as light as necessary and progressively add more and more force to get the pressure that you need. Now, we're going to work a little bit on the outside of the elbow. So injury, strains, and overuse here, often referred to as tennis elbow. Today, we're going to utilize one of our tools here. At home, I prefer using a dull butter knife. And I use the back edge of it, the non-serrated side, the non-blade side. And we have a little bit of lotion here. This just helps with movement of the tool over the skin. And we're just going to apply a little bit of friction, a little bit of force. Now, as I do this, I'm not pressing straight down onto the skin. I have my instrument angled about 45 degrees, and I'm scraping along the fibers of the muscle. When working on the outside of the elbow, having your hand in a thumb up orientation position like this helps kind of bring the muscles a little bit more to the surface, makes it a little bit easier to work into. And we use kind of the same landmarks as we did for the inside of the elbow. We have bony prominences on the outside here. We start just past them, and we work our way down. And we work small areas at a time. We're not going long, broad strokes all the way down. We work a small portion of the skin, and then we progress to the next section. Some things that we would expect with using instruments or tools like this with scraping would be a little bit of reddening on the skin. That just indicates that there's more blood flow to the area. Introduction of more blood flow to the area just helps out filter some of the waste products as well as kind of accelerate the healing process. And it's a similar idea for the lacrosse ball. We're going to work along the length of the muscle fiber. We can also apply a little bit of force going transverse to the muscle fiber, going across it. Muscle fibers run in this orientation, so we're going perpendicular to it. Now, as a follow-up to those soft tissue techniques, we did about 30, 60 seconds with the lacrosse ball. We apply the same time with the instrument. We're going to follow up with a little bit of stretching. Now that we've gotten the soft tissues loosened up, we're going to just get the wrist working and bending in positions that otherwise would be inhibited by those tight muscles. So with this stretch here, working what's called wrist extension. And that's targeting the muscles that are on the inside of the elbow here. Once we feel the point of stretch, we hold for 1001, 1002, and then we relax. In this position, my forearm is up, my palm is up, grabbing onto my palm, not crushing my fingers, just giving them a gentle cradle, and bringing my wrist back until I feel it stretch. Again, this is kind of stretching out the area that would commonly afflict golfers or weightlifters. For us to get the area that would commonly afflict tennis or racket sports, we're going to go into wrist flexion. So we're going to go palm down. It'll be the same idea, same movement. Grabbing onto either side of the palm in the hand, bringing the wrist down towards the floor. This is giving me a nice stretch along that area that I was just scraping earlier. Same idea, we're going to hold that stretch for 1001, 1002, then relax. And for each of the muscles, we're aiming for about 10 to 15 repetitions. Now we're going a little bit higher in repetitions, a little bit shorter on the duration because these muscles are working more dynamically when they get overused. It's the result of multiple repetitions, multiple impacts. Therefore, we're going a little bit higher in the repetitions to kind of prep them for that movement again. Next, I'm going to show you guys a little bit of a stretch that we can get the bicep. This is an area that frequently afflicts weightlifters as well, and on top of that, some throwing athletes too. Now, for a little bit of a bicep stretch, again, an area that's frequently overworked, overused for weightlifters as well as some throwers. We have the corner here of the wall. My arm is going to be out straight. I'm going to make an L shape with my hand. I'm going to nestle the crux kind of webbing of my hand, of my fingers on the corner of the wall there. My elbow is straight, my arm is straight, my chest is facing forward. Right foot's in front of the left foot. I'm going to get a little bit of a lunge onto my right leg. The wall here is preventing my arm from going any further forward, and this is giving me a big stretch along my bicep here. Bicep has two heads, one of which starts at the shoulder, the other starts at our arm here. Both attach just past the elbow to this portion here. And it's going to be a very similar idea for the wrist stretching that we were doing earlier. We're going 1001, 1002 when we feel the point of stretch. Then we return. As far as repetitions go, we're going for 10 to 15 repetitions. The further you lunge forward, the more of a stretch that you're going to feel with it. Additionally, getting some rotation through the chest while you lunge will give you an even bigger stretch too. Now, for soft tissue, for stretches, I like to do them once to twice a day, in the morning as well as the evening. Soft tissue work prior to the stretches can help loosen up some of the muscles, get them moving a bit easier, while stretching kind of helps reinforce the increased length that we have, decrease pain, as well as get them prepped and ready for some more dynamic movements. Thank you guys for attending this week's newsletter. Next week, we're going to go over some exercises to strengthen and get the elbow and forearm prepped for more dynamic, exciting activities. See you then.